I chose the field of dermatology because I wanted to be able to help people who were fairly healthy and had a fully functioning brain to be able to lead a happier, more confident life. Platelet-rich plasma treatments have offered me a great tool to provide such service to people who wish to explore it. Here is a video on the subject. I'd like to tell you about a really cool, absolutely painless medical treatment called a Rhino Boost, which employs a person's own repairing and regenerative molecules to revive essentially any partially damaged tissue to function like it did back in youth. Platelets are these cell fragments that run in our blood, and they are only employed when a capillary, a tiny blood vessel, is cut. They recognize the molecules that are released at the edge of that cut. They stick to that cut edge. They participate in formation of blood clot. On the other side of the blood clot, the body needs repair and regeneration. Platelets contain these molecules. They burst, they release their content, and that's how other cells are gathered, or the cells that reside there. They start functioning and they get into the repair mode, and the tissue is revived again. In the case of genitalia, the tissue receives inadequate blood in the unexcited mode in men and women. So every day, every hour, it's sort of like a blow to the tissue. We deliver these molecules that are stored in your platelets and platelets to repair and regenerate the tissue to function like it did back in youth. This procedure is performed by applying a very potent numbing gel to the genitals. And in my experience, 70% of people are adequately numbed up to perform this procedure painlessly. 30% are not, and perhaps a good 20% of people aren't numb at all, either because their skin is not permeable or that they have enzymes in their skin that breaks down the anesthetic agents really efficiently so they don't go numb. I numb the area by, in a way, turning off the circuit breaker so that I could do what I need. I inject the buttocks, each buttock with one shot, and that targets the main nerve fiber that innervates, meaning brings sensation and relays signals back to the brain from that area. And the genitals are so numb that the patient can be given a needle and he or she can put in the needle into their own tissue without feeling anything. Again, because it's absolutely numb. I only proceed with the procedure, and the patient only pays if they are absolutely numb. And again, I give them a wood stick and then a needle. If they could poke themselves, then we can go ahead. Now, you might ask, well, there is a pill or a number of pills that a person might take, and it makes the genitals function the way they did in youth or even better. Phosphodiesterase 5 inhibitors, such as Viagra or Cialis, they function in a way that, say, if you were to beat up a tired horse, yes, the horse would run a little more, but eventually it breaks down. If you ask your doctor or people who've taken it, they need to take higher and higher doses of Viagra and Cialis. After a while, those don't work. The person would have to inject. The next step would be to inject the male genitalia with the mix of these three compounds called trimix. And yes, they see benefit from that. After a while, that won't work either. And the next step would be to have an implant put in. Platelet-rich plasma treatment delivers repairing and regenerative molecules so that the stem cells that are in the tissue could function like they did in youth. See, every organ of ours, whether it's skin, liver, bone, we have a stem cell. It divides into two. Now you have two cells. One of these cells begins to go through a process called differentiation. It accumulates features, or certain genes are turned on and off in it, that it can have certain features to be like that organ. So it acts like a skin cell or a liver cell. And the stem cell can divide again, and here you have this process. But the stem cell can only divide itself a number of times. Many of these cells accumulate damaging or damaged molecules inside them, which is toxic to the cell, and eventually the stem cells die off. Platelet-rich plasma revives and repairs the stem cells. That's how it makes the tissue function it did in youth. Whereas Viagra or Cialis or Trimix, they put the remaining of the stem cells in hard work again. Eventually those burn off and that's it. Platelet-rich plasma treatment or Rhino Boost can help a patient need much lower doses of Viagra or Cialis, or in many instances not at all. I believe this Rhino Boost or platelet-rich plasma treatment would be the standard of care for anyone who cares to have a fully healthy and functional life. I've heard men telling me that, men in their 40s, late 40s, telling me that they haven't had sex with their wives for a long time, but they really think it's psychological. Or many men in their late 40s or 50s are excluded from dating or being eligible to date and get married and have a child because women think they can't get hard again. PRP can blow life into these people so that they could lead their life with full health and function like they did decades ago. The effect of PRP manifests usually 3 months after the treatment, sometimes even as early as 2 weeks, but usually 3 months later. And it lasts for a year or many years, depending on the patient's health status. Thank you for listening. I'd love to hear your comments and questions. I have videos of patients who've undergone this treatment to present to you how absolutely painless it is after the nerve block. Without the nerve block, I agree. It's either tolerable or some patients totally feel it. But you can be assured that with 2 shots in the buttocks that are very tolerable, the whole genital area goes numb and we can proceed. Thank you again.
Thank you for watching our video. If you have any questions, please call us at 310-826-2051 or visit us at brentwooddermatology.com.